It's a landscape of drama and contrast, and for 20 years this part of Tanzania has been linked to northeast England. Health teams from our region make regular visits to Kilimanjaro Christian Medical Centre, a hospital in the mountains' foothills. In recent times, a focus of their work has been on helping burns patients like little Diana. But efforts to improve healthcare for women and children began many years before.
This is where all the kings and queens are born.
In this busy delivery unit, 4,500 babies come into the world every year. Each mother-to-be receives at least one free ultrasound scan during their pregnancy to detect potential complications. This ultrasound machine was once used by northeast patients at the Northumbria Healthcare Trust. Although it was replaced with newer technology, the machine was still in good order, and so it was donated for women here.
This collaboration, of course, has been an example in terms of providing those services free of charge, and of course, with the donation of those ultrasound, the department has really improved in maternal health care.
The ultrasound project was extended to hospitals in neighbouring rural areas. To see one of those places for ourselves, we climbed north towards Mount Kilimanjaro. I'm standing above the town of Moshi. Kilimanjaro Christian Medical Centre is visible below. The scenery and the weather couldn't be more different from the northeast, but these two areas now share a deep bond. Here in the remote community of Kibosho is a small district hospital where I talked to Brenda Longstaff.
What we achieve and look what we learn.
She leads the Health Trust charity Bright Northumbria, which fundraises in support of the partnership. How proud are you with what's been achieved so far?
I think all of the people who've been involved in this work can be hugely proud of what they've achieved, because they've helped to bring in new services for Tanzania. Everything is done to make sure that it will end up being total ownership by our Tanzanian colleagues, and we know then it's going to go on forever and ever.
And that responsibility will fall to young Tanzanian medics like Dr. Jamil Suleiman. He had training in our region under the partnership, though it wasn't all about medical skills.
One of the main things that I learned there was the patient-centered treatment that you have, which really helps me, take care of patients here, because patients here really want the one-to-one conversation with the doctors and their relatives too.
What did you love about being in the northeast?
Football. Yeah, I loved football. I was watching England play for the World Cup, so I was there cheering for England, and I was very sad when they lost. Yeah.
Sunday morning, and it's standing room only at the church within the grounds of Kilimanjaro Christian Medical Centre. It's a chance to reflect on the week gone by and look ahead.
The situations you find yourself in here are like nothing you ever find yourself in at home. And the people as well, they are in awful circumstances and have these awful injuries, but they're so grateful for what you're doing.
When I go home, definitely look at things differently and not take things for granted, I suppose.
I think we can look forward to an exciting future of this partnership. Everyone who comes here thinks it's a privilege and they learn so much, and that's why it'll have energy to continue and continue for the years ahead.
And that means staff at this busy hospital carry out their work knowing they have the support of colleagues thousands of miles from this great mountain.